So good afternoon, I'm Carmen Santos. So for today, I am here with a patient that's diagnosed with cancer, cervical cancer, and having a complaints of low back pain that's radiating to a posterior thigh. So for the assessment, I will be doing a Gieslin test. So for this, if this positive, the patient might have a ankylosing spondylitis. And for the treatment, I will be doing a energy conservation exercises or stretching that will maintain the flexibility of the muscles of the patient. So before we start, I will be doing antiseptic technique. So hello ma'am, good afternoon, Army Santos. May I know your name? So good afternoon ma'am Arlene. So for today, before we start, I will be touching some parts of your body. Please allow me to do so. Okay. So, right. So checking the vital signs first. So, assuming that the vital signs are within normal limits, ma'am. So, for the assessment po, before we start, do you have any underlying condition aside from your conditions right now? So, you have a diabetes. So, do you have any past surgery of the hips? Okay, so there's no lacerations or open wounds of the patient. So, we will proceed with the assessment. For the Gieslin test, can you move a little bit here, ma'am? Okay. So for the Gieslin test is, I will, okay, just keep it right here. Okay. Do you feel any pain on her right here? So, okay. So it is a positive because the patient felt pain, and that might consider as the patient having a pain on the back or having a AS. So for the assessment, and for the treatment, I will be doing is stretching exercises that will help the patient for energy conservation exercises or to do his hobbies such as gardening or working around the house, doing his house chores or gardening. So for the stretching exercise, I will be more focused on the hips since the patient might have having difficulty in walking since there is pain on the area. So for the stretching, ma'am, just flex the knee first before this. So I will be doing this in the pain-free motion exercises. Okay. So I will be doing this for 15 to 20 repetitions with three sets and within 15 seconds hold. Okay. So assuming that the treatments are already done, so ma'am, so please do this, or we can also apply is hot moist pack on the back area of the patient to decrease the pain before doing stretching exercises. So ma'am, please do the exercise that I taught you earlier to help you with your activities or your hobbies and for you to enjoy it without pain or with minimal pain. So during this assessment and treatment, do you feel uncomfortability? Okay, no. So, ma'am, if we are already done, so thank you for your cooperations. You can do this with your caregiver or with your family members. But if you're lifting anything, please advise that look for some help before us. Okay. So, checking the vital signs again. So, assuming that the vital signs are within normal limits. So, thank you, ma'am, and have a good day. So, aseptic technique. So, thank you and good afternoon.